Mr. Boston, what is HIE, and did malpractice cause this in my baby? Want to know what I'm getting at here? Stay with me as I share with you this very important information. Hello, I'm Marcus Boston, and I'm a childbirth injury and medical malpractice attorney practicing law here in the state of Maryland, and I would like to quickly talk with you today about HIE, or Hypoxic Ischemic Encephalopathy, and how we can see it in these types of cases. All right, before I get too far into this video, I want to go ahead and give you a definition of HIE. And essentially what we are looking at is when a baby does not get enough blood and oxygen, and you can have a brain injury as a result of that. So essentially, that's what we're talking about in general when we're looking at HIE. The baby's not getting enough blood and oxygen, and then you can have a brain injury as a result of this. How we can sometimes see this show up is that a mother will present to the hospital, and the mother will a lot of times have an uneventful pregnancy. Everything was going pretty good. There were no problems. And the mom will check in and everything will look right or look good at the beginning. They may do a sonogram at the beginning of everything just to make sure everything is okay and everything can show up okay. But what can happen is during the process, during the vaginal delivery process, there could be some flags that show up. And I want to quickly now jump in and talk with you about a very important tool that is used when we are talking about these types of cases. And that tool deals with the electronic fetal heart monitor. That's right, the electronic fetal heart monitor. This is a very important tool that doctors and nurses are using when we are talking about a vaginal delivery. The reason this tool is important is because it can help doctors determine how well your baby is tolerating a vaginal delivery. It's looking at the baby's heart rate, and it's providing important information to the doctors and nurses. But what can sometimes happen is that fetal heart tracing will display signs and flags that are very important for the doctors to pay attention to. And if the doctors are not paying attention to some of these flags that could be seriously suggesting that the child is no longer tolerating that vaginal delivery well, then the doctors and nurses have to take certain actions based on what they are looking at on the strips. This can sometimes mean that the doctors will have to perform an emergency C-section. And if that C-section is not performed, then you can have injury to the child's brain. We can sometimes know that the baby is having a hard time when after the delivery, the baby may be blue in color. The baby may have low APGAR scores. The baby may suffer from seizures. The baby may have to be removed from mom and taken to the NICU. The baby may be dealing with MAS or meconium. I mean, there could be a lot of issues that could be present with the baby. So why have I taken the time today to talk with you about this really important information? Because I'm trying to give you insight into this process. I'm trying to help you understand a little bit more about HIE and how, in certain instances, questions of malpractice can arise because doctors and nurses are not paying attention to the signs that are there, to the signs that are letting them know that the baby is no longer tolerating that vaginal delivery well, and that an emergency C-section should take place. And if the doctors do not perform that emergency C-section, then you can have injury to the child's brain. If you have more questions about what's going on with your child, if you would like to talk with me about questions that you have right now, this is what I invite you to do. And remember, taking this next action costs you absolutely nothing. And what is that action? To pick up the phone and give me a call. I could be reached at 301-850-4832, or if you prefer, you can send me an email to medicalinjury@bostonlawllc.com. I answer Maryland medical malpractice and childbirth injury and wrongful death questions just like yours all the time, and I'll be happy to take some time to listen to your story. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys here at Boston Law Group, LLC, and we will see you next time. Take care and enjoy the rest of your day.